Today, we explore the functionalist approach and how it informs Australian community services. Functionalism views society as a system made up of interconnected parts that work together to maintain stability. In practice, this approach helps community service workers understand how families, education, health, housing, and employment interact. For example, when a client loses housing, their health, employment, and family roles are also affected. Functionalism encourages practitioners to restore balance across systems rather than treating problems in isolation.
Functionalism compares society to a living organism. Just as the heart, lungs, and brain perform different functions, social institutions such as family, education, government, and health perform roles that keep society operating. In community services, this means understanding clients not just individually, but within systems. For example, supporting a young person involves education, housing, family, income, and mental health services working together.
Functionalism emerged in the 19th century with Auguste Comte and Herbert Spencer, who saw society as a complex organism. Emile Durkheim later emphasized social solidarity and shared values. After World War II, Talcott Parsons and Robert Merton developed system-based theories explaining how institutions maintain order. These ideas still shape Australian policy design and service delivery today. Social harmony means society works best when institutions operate in coordination. If one part fails, others are affected. For example, when affordable housing is unavailable, families experience stress, children's education suffers, and health deteriorates. Community services aim to restore harmony by linking clients to housing, income, and well-being supports simultaneously. Functionalism emphasizes social order through shared norms, values, and institutions. These guide behavior and prevent chaos. In Australian community services, programs such as parenting education, youth mentoring, and family violence prevention reinforce socially constructive behavior and help clients participate safely and productively in society. Institutions are interdependent. A change in one system affects others. For instance, unemployment impacts mental health, family relationships, and housing stability. Community service workers assess these links when supporting clients, ensuring that employment services, counseling, and housing providers coordinate rather than operate separately. Robert Merton introduced manifest and latent functions. Manifest functions are intended, such as schools providing education. Latent functions are unintended, such as schools providing childcare and social networks. In community services, a youth program may aim to reduce crime, but also builds friendships and self-esteem, strengthening social cohesion. Functionalism views inequality as serving a purpose. Some roles require more training and responsibility, so higher rewards attract skilled people. For example, doctors earn more than fast food workers because of complexity and risk. In services, this logic influences workforce structures and professional training systems. Australian policy reflects functionalism through structured frameworks. Systems like NDIS assess capacity, allocate resources, and review outcomes. This creates predictability and accountability. Community workers operate within these frameworks to ensure clients receive consistent and coordinated support. Functionalism promotes integration rather than isolated services. For example, a person with mobility impairment may receive occupational therapy, physiotherapy, transport assistance, and social participation support through one coordinated plan. This prevents gaps and duplication, strengthening overall system functioning. Community service workers assess clients' social roles, such as parent, worker, or community member. Interventions aim to restore these roles,
For instance, supporting a single parent with childcare access enables employment participation, improving family stability and economic independence.
Maria, a 35-year-old with cerebral palsy, receives NDIS support based on functional assessment. Her plan includes personal care, assistive technology, and wheelchair modifications. Each element serves a function toward employment and independent living. The strength of this system is structure and accountability, though rigidity can limit flexibility. Functionalism offers a broad systems perspective. It supports integrated service delivery, evaluation frameworks, and policy development. For community services, this helps design programs that address housing, health, employment, and social participation together rather than separately. Functionalism is limited because it can ignore power dynamics and justify inequality as natural. It focuses on stability rather than transformation. For example, migrants or Aboriginal communities may face systemic disadvantage that cannot be solved by restoring existing structures alone. Practitioners must therefore combine functionalism with critical and rights-based approaches. For community service practitioners, functionalism encourages systems thinking, coordination, and structured planning. However, workers must balance stability with advocacy and social justice. In Australia, effective practice integrates functional frameworks with person-centered, culturally responsive, and empowerment-based approaches to ensure services are not only efficient but fair and inclusive.